As cases continue to increase in the state and across the country, we want to get a look at what doctors and nurses are dealing with right now. So this morning we're joined by Dr. Ross Goldberg, Vice Chairman of the Department of Surgery with Valleywise Health Medical Center. And Doctor, we know all along when talking about COVID-19, the concern has always been on the strain of hospitals. How are you guys doing currently?
Well, first, good morning. Thank you for having me. We are doing okay right now. We can take care of those who have COVID and the other issues that are not COVID related. As you heard in the previous interview, the concern is what's going to happen in the near future. We want to make sure that our resources are still able to be used for everyone at all times.
We spoke with the governor last week in a news conference, and he didn't issue any mitigating factors. For a hospital to see that with the numbers continuing to surge, are you guys having to add some of those mitigation factors yourself, as you just heard, maybe suspending elective surgeries or stuff like that to try to slow down the people coming into the hospital?
Well, we've always had protocols in place regarding who comes in and comes out of the hospital, wearing masks, keeping things clean. As far as the elective surgeries go, we monitor things very carefully. But as you heard before, it's a balance. You want to make sure you don't create a big backlog of things that you want to take care of. So we evaluate day to day based on our data and make the changes that are as needed. It's kind of built into the system already to be very mindful of where we are, what our bed situation is, what our staff situation is, and we're very fluid when it comes to that. But as of right now, we're still doing okay. We're still able to move along and take care of the patients we need to take care of. It's that concern that if we get another big surge on top of everything, what will that do to the system? So we're aggressively asking everyone to please be mindful of all this, especially during the holiday season.
And I know you just heard Dr. Kara Chris talking about resources. That's a big concern with the country surging at one time. Unlike last time where they were able to pull resources from other states. What is your plan if these resources continue to get thin?
Well, it gets to an area where we don't want to find out what our ceiling is as far as limitations. You know, you hear the crisis care standards, things like that. That's something we don't want to get to. So we are working as hard as we can to ensure that we are there for everyone, which we still are. But again, we're looking to everyone for their help. Mitigation standards, as far as mandates, you know, they're nice to talk about, but everyone needs to follow the guidelines. It's frustrating when you have to talk about getting mandates for people to do the right thing. We've already proven that the mask wearing, the social distancing, all of this has a positive impact in stopping the spread of the virus. I know people are tired. There's pandemic fatigue. The virus doesn't care. It takes advantage when we get lax on our responsibilities. So it really falls onto all of us to continue to maintain those mask wearing, social distancing guidelines, and hand washing to make sure we don't have the spread of the virus continue.
Especially going into the holidays.
Yes, absolutely.
All right, Doctor, we thank you very much for the amazing work you guys do over there. Please send our best to your entire staff.
Thank you. Have a happy Thanksgiving.
Thank you. You too.